device, you turn it on this way, and then of course the opposite.
This here is going to control how much suction you're gonna have. The top here, you're gonna have regular suction. It's just continuously sucking off, obviously. And, well, this should be intermittent. It's not full. It's gonna say intermittent, which is gonna suction, stop, suction, stop. So it's gonna be your intermittent suction. That's where we're gonna have our suction set up. Because we don't wanna continuously suction. At the beginning, if there's a lot of blood, we may need to do more of the regular suction so that it keeps sucking all of that blood or all of the fluid that's in there that's making them sick. And then you always wanna put it to intermittent. Okay. This was straight in. All color coded. This is white. This is white. Just push it right in. And there's a device that's gonna go from the section here to this other section.
That's what I said, I couldn't take it out of there. Oh, wait, where's the
So that small section tubing is gonna go into where it says vacuum. So that's gonna go there. And then this is where we empty. There's a bigger section here where we can empty the contents into the restroom with just water. And then we have the one that goes to the patient. That's the one that's gonna go to your patient, and it's all labeled here on top of the vacuum.
connection to the, yeah.
So this one's gonna go to your patient. And then we're gonna have let's call it yonker, so the suction tubing, in case you need it, the suction for whatever reason. This one has a little hole here. If you press on it, it'll suction. If you let it go, it's not gonna suction. This is what they use at the dentist's office. Oral suction. Okay, so I set it up here. And this one is gonna go to the vacuum.
You have to take that into the computer and get here, okay? I'm gonna show them.
They're gonna show you the yonker right now, Mrs. Jepson. But I already have it set up. I have to have it set up already. If I want it to go in the green, I'm gonna turn the dial on and just leave it off for now. So we don't have suction right now because it doesn't work.
This is the yonkers for oral. This is the connection tube.
I got your tab.
This is the device. Don't drop it because they do work. Look at it.
The first nasogastrin we're gonna do is for decompression. The patient came in with GI bleeding. He's in the emergency room. The doctor wants me to place a saline sump, and it's gonna go to low intermittent suction. Just gonna wait for Mrs. Jepson to come back. Always have your suction set up ready. Even if you don't open it, just have the suction, the tubing, in its container in the room, and have a yonker or the suction tip ready. So you don't have to open it. But because if there's an emergency, you need to make sure that you have suction set up. Very, very important.
So do you want me to be just like the one that's needed? Another one?
Yeah, okay, first I'm gonna,
Yeah, please, so
Yeah.
exceptional to us.
first I'm gonna do the tail sump, and then I'm gonna go ahead and then do the feeding too. Okay, so I just wanna show them. Okay, so the materials you're gonna need, you want to have a cup with water and a straw. You need to have a jelly, lubricant, your pH strips, somewhere to put the gastric fluid. This is the 60 ml syringe that we were talking about.
It's tapered, okay? It's a big fat tapered syringe here up against start. All right, it's a big fat thing.
You need your NG tube, your light, tongue depressor, a little towel, a measuring device, oral care, some tissue, tape, and a three-way valve that we showed you earlier, and somewhere to put some water also. And your gloves, clean gloves. This is not a sterile procedure, it's clean procedure. Okay. So first, I'm gonna go ahead and verify the orders in. The doctor gave me the order to go ahead and place this tailor sump in place because the patient has some GI bleed. And I'm gonna go ahead and I'm gonna review the chart. I wanna make sure the patient hasn't had any cranial surgeries, nasal surgeries, because I wanna make sure that this tube is not gonna go up the brain, right? Because that's gonna be a very bad outcome. I'm gonna go ahead and assess the patient, and then I'll go ahead and ask them a bunch of questions. All right, so I'm gonna go in, we're gonna knock.
Hello.
Hello, may I come in? Hello, if I'm coming in, I'm gonna go ahead and tell them. Introduce myself. Good morning.
Honey.
My name is Carmen, and I'm gonna be your nurse today. I'm gonna go ahead and check your IQ.
Hi, Carmen.
Hi, is your baby prescription young?
Yes.
And date of birth is?
2/21, 1931.
Okay. As I'm doing that, I'm already with my little bag, I'm checking, making sure that the bed is locked. There's no abnormal smells. I'm gonna go ahead and put my gloves on. There's no tubing coming out of anywhere. Any allergies, Mr. Kirchner?
I don't think so.
All right. Are you having any pain right now? In your
In
stomach?
my stomach, it feels full and bloated. I've been vomiting. Oh, it smells.
Any allergies?
No, I don't think so.
Okay, sir. Okay, Mr. Kirchner, since you have been vomiting and your stomach is very distended, we're gonna go ahead and place the nasogastric tube. And this tube is gonna go into your nose, all the way back into your stomach. And we're gonna go ahead and put it to suction. And once all this is, once the blood is out of your stomach, you're gonna feel better.
I hope so.
Oh, I feel like vomiting right now.
Oh, no, hold on, sir. I'm gonna go ahead and give you a little basin here. If you need to vomit. First of all, I'm gonna have to do some assessments. I have to assess the notes and ask them a series of questions. Section. Get the section ready. Okay, so go ahead. Right on to regular. Go ahead, section. Okay. All right. There you go. We have coffee ground MSS. Okay, I gotta get rid of that into the restroom. I'm gonna go ahead and I'm gonna give you some oral care or set up everything so he can give himself oral care because that stuff is not a good tasting material in your mouth. So turn it off. There's part in here. Okay, sir. I'm gonna go ahead and look into your nose. Any fractures? I'm looking for polyps.
She's looking for polyps.
Go ahead, Robert. Okay. I'm gonna put the head of it up because it's too low for me. I want the head up. All right, sir. I'm gonna look for polyps.
She's looking for polyps.
I'm gonna close one of the nares and can you breathe in?
Breathe in through one ear. Breathe in through the next. She's looking for broken septums, fractures, skull fractures, any nasal surgeries.
I'm gonna go ahead and get my tongue depressor. I'm gonna go ahead and look at the back of your throat and check for a gag reflex. Okay, sir.
He's got a gag reflex.
Alright. I can go ahead and assess the abdomen. I'm gonna look and see, I see that it's distended. I can go ahead and measure the girth, abdominal girth, so that I know where I started and I can reassess every day. So I'm gonna go ahead and place the measuring device and measure it right at the umbilical area. Now where you know where you're gonna be measuring from when you pass out the report. And then I'm gonna chart that and document it and report it to the next nurse.
So you'll put the tape all the way around.
Yeah, all the way around. Okay, sir. So when I start putting this nasogastric tube in your nose, it's gonna be uncomfortable, but I need you to help me. And as I advance the tube, you're gonna start to gag, and your eyes may tear. But if you cannot breathe at any time, just give me a warning sign with your hand. Lift your hand up and tell me that you can't breathe, okay?
She's giving him instructions saying he's gonna be uncomfortable, might make him kind of tear up and cry. If at any point he feels like he can't breathe or he gives a signal with his hand. That's what she was teaching.
This is not a sterile procedure, but you still want to keep everything clean. I'm gonna first measure the tube to see how far I need to go in.
This is important. Pay attention.
I need to actually get a visual. I don't want to guess. All right, so I'm gonna measure from the tip of the nose
The tip of the nose,
to the ear,
earlobe.
all the way down to the epigastric region.
So you have to have a visual of that epigastric.
So right about here, I'm gonna put a little piece of tape so that I know how far I'm going to go with this. Now, don't put a lot of tape because you have to take it off. All right, good.
And don't wrap the tape around, because you have to take it off. Make something easy. I usually flap it and I put little turns in the end so that I can just peel it off fast.
Now, if I don't want all that fluid coming out onto my bed, I may want to go ahead and place the Lopez valve so it's not all over my bed. And I'm going to place it and turn it off to the patient.
Okay, can you see it? It's off.
White adapter.
At the end?
Yeah, one of those. Otherwise, it's not gonna. Okay, Mr. Kirchner, as I start to insert the nasogastric tube, I'm gonna have you drink a little bit of water, and every time that you drink a little bit of water, I'm going to advance the tube, and this makes it easier for the tube to go into your stomach. All right? It's okay, we'll figure it out. Okay, we'll figure something. I know that we had one there. All right, so we're gonna go ahead and lubricate it, and we're gonna lubricate it 2 to 4 inches. You can do it here, or you can do it on the paper that you open your, from the NG tube, you can do it there too. But remember to always measure it, otherwise when you insert it, you're not gonna know how far to go to insert the tube. I should have also asked the patient if he's ever had an NG tube and how their experience was with that tube. Sometimes the patient will require like a xylocaine jelly, but you need to have an order for that. That's a medication, just numbs it up. All right, sir, we're gonna go ahead and start the procedure. All right, so we're gonna go ahead and we're gonna have the base tilted upward a little bit. When he starts to cough, then we're gonna go ahead and have him, put the chin to the chest, and then I'm gonna continue to advance. Okay, sir, here we go. Okay, I'm gonna try to do this as carefully as possible. So I'm gonna go ahead, I like this side, both of the nerves are taken, so I'm gonna go ahead and select this side. Yeah, that one, this one. All right, so we're gonna put your head back. I'm gonna give you some tissue just in case some tears come out. So we're gonna go back, set the head back.
Just if I stop, you could help them tilt their head back if they can't. You could put your pillow back and something so they just slightly hyperextend, okay? You might even put it down on the bottom, but you don't want it like this yet, okay? So just hyperextend it.
All right.
Just as mannequin,
Okay, here we go. So we're gonna go on the floor, the nose is straight back. If you have any difficulty, you can go ahead and turn a little bit. Now he's gonna start to cough. Now I want your chin to your chest, and I'm gonna go ahead and drink a little bit of water. And every time you drink some water, I'm going to advance. Drink.
Go.
Good job, Mr. Kirchner. And I'm assessing, making sure that he's not turning blue, and he can even do some humming sounds. And if he can't hum, that means I'm in the wrong place.
You hear that? You could have him hum, and if you can't make that noise, you're in the wrong place.
All right. So now it's where my little holder is. That's where I want it to be. Nothing's coming out because I have this off. All right, so I'm not making a mess. Now I better make sure that it's not coiled in the mouth. So I'm gonna go ahead and get my tongue depressor. I'm gonna go ahead and look in the back.
It's something to see it hasn't coiled in the back yet.
It looks like it's in the right place.
And you can see the tube, it's just a straight little line.
It looks like it's in place. How are you doing? You're okay?
Oh, I'm okay.
All right, you did a very good job there.
Oh, it was a weird feeling.
Yeah,
Oh, it's done with.
it's done. All right, so I'm gonna go ahead and, I can go ahead and tape it. And we're gonna make the little pants that Miss Jepson made. And, you can go ahead and clean the nose up at the top. There's a little jelly there. I was telling him that we could use silocaine jelly if it's ordered.
Yeah.
In reality, this Salem sun is gonna have numbers, so you're gonna be able to know where you left it just by looking at the numbers on the side. So you can document where you left it. And I placed it in the right near, maybe it's at 65 centimeters. All right. So I'm gonna get a little cleaning.
It's called like a skin barrier,
Skin prep.
skin prep. It looks like alcohol prep, but you just wipe it and it takes all the debris out.
And it kind of makes it a little sticky. So now I'm gonna go ahead and make my little pants. I'm gonna place it on the nose. It's hard to do it with your gloves, but you need to. Okay, there you go. One goes under. And then the other one goes over. And I like to place another small piece on top of the nose, just to kind of give it a extra support. All right, so this is gonna be to suction, so I can go ahead and place it to suction. I have my suction ready. It requires this little adapter, otherwise it's not gonna go in this loop. I open it up, and I can go ahead and start the suction process. And now I see there's already 300 milliliters of blood in there. Okay, once it's not coming out as fast, I can go ahead and put it to intermittent. I'm gonna do regular suction first, and then once I see that there's not much coming out, I can go ahead and put it on intermittent. Okay, all right, now we can do checks, right? I know that I'm in because I'm getting the blood out, all right? But in order for you to check it, you can get a little bit of gastric fluid, and then you put it in your little cup, so nothing comes out. And you get your pH strip. Make sure that it's for GI. Make sure that it's not expired. Put it in there, leave it in there for as long as the instructions tell you.
FYI, this is for urine. We don't have the gastric, so we're pretending, okay?
And it hasn't expired. And I'm gonna check, and the pH is 5.0, which is okay. Now for this one, I know I'm in the stomach. It says I see all the blood going through there. Okay. This is only if you're gonna do it for suctioning. All right, so now I need to make sure that I come back and I give him oral care, or have everything ready for him to give himself oral care, because now he's gonna be breathing with his mouth open, and he needs to have oral care, okay, so he can feel better as far as comfort in his mouth. All right. Now, if you didn't have numbers there, you can also measure the tubing that's on the outside, okay? So I can measure from the point of exit from the nair all the way down to the end of the tube, which is here. So 26.5, oh, we're gonna do by centimeters. Oh, 67 centimeters. It's gonna be the amount of tube that's coming out,
From the tip of the nose to the end of the tubing.
which is right here. This is the end of the tubing.
Where you connect, and that's what you document in your 67
Centimeters.
centimeters.
And then,
We do not mark with a black marker.
so I'm gonna go ahead and I can get a little bit of rubber band and like a little safety clip. You just put it up here. This needs to be above the stomach. All right, so I can go ahead and place it here with a pin and a rubber band, and just to hold it there, so it's not pulling. When I tape it to the nose, I need to make sure that it is not against the nose, causing a pressure ulcer. It's gotta be loose, kind of loose. All right? If you guys have any questions, go ahead and text me.
You guys have any questions or no?
You'll see some of the nurses in the hospital also take her placement. It's not reliable, but they still do it.
Because he threw up to.
Oh, with a feeding tube, okay, so we'll do it a little later.
I'll be sitting there going,
If you guys have questions, go ahead and send it to me now.
what if he's nothing by mouth? Then you would just have him.
I guess no questions, all right. So if this patient, let's say the patient is gonna get to go home, and I'm gonna go ahead and remove the tube because he's doing much better. I'm gonna come in and explain to him.
Can we just ask her through
Oh,
the?
they
Oh, they are, yes, okay. Okay.
We hear you. Can we have some students go in and see the placement of the tube before removal? Yeah, okay, yes.
Two at a time?
2 at a time? Yeah, 2 at a time.
One from each row, one from each row.
Who wants to go look?
Can you hear me?
Yes.
Are we
Oh, yeah.
Yeah, one from each class.
You can take a picture of it.
Go.
Are you guys coming to see?
One from each row, let's hurry, come on. Or two.
So you can see the tube.
Yeah, I think they wanna.
So you wanna make sure that the tube is not like right on the nose. So it's kind of like, you know, just going there.
Can you show us how this could have built with the light?
How do you want? How do you want? Oh, this one, the this here, oh, you wanna look at it? Okay, go ahead. Put it down, and then you can see the tube in the back, I like throw it straight in.
Oh,
Yeah?
yeah.
Yeah.
Sure.
Can you see it?
Yeah, hold
It's okay.
I know, I just hear.
No more.
Just to measure this. Sometimes sometimes it's sticking out and you're like, oh, wrong place.
Yeah, like, well, is that it?
That's it? Yes, and you'll get share the pictures.
Oh, okay.
All right, Mr. Kirchner, it looks like, there's no more blood coming out of this tube. You don't have any nausea, no vomiting. Your abdomen is flat now, it's not distended. Does it feel better? Does it feel better?
You could measure if you want it.
Measure.
Oh, I think that's the wrong.
Okay, the stomach. Yeah, so I'm gonna re-measure the stomach, and I noticed that it's getting smaller, so that's good, right? And you have to also check, as soon as you put it in, as soon as you put the AG tube in, you wanna measure how much blood came out, that we need to document. And if you need to flush, let's say that there's a lot of blood and you need to flush with some sterile water because you need to make sure that it stays patent, that it's not gonna close up on you. You're gonna go ahead and get a little bit of sterile water, like 30 milliliters. And I'm gonna go ahead and irrigate in this irrigation port. This is where the little red cover was. So I'm gonna go ahead and take the red cover off. I'm gonna place it in this little hole, which is a holder right there. And then I'm gonna have my 30 milliliters of water in here. Now, I'm gonna turn it off to the suction. The suction is off now. I'm gonna turn it off to the suction, and I'm gonna go ahead and irrigate. Now it's going to him, into the stomach, and clearing off any debris that's in the tubing. And then I'm gonna turn it off. This side, so now nothing's coming out. I'm gonna take my little cover and cover it up. And now it's gonna start to suction as soon as I turn it back on to low intermittent. It's gonna come out. Now, at 6 o'clock, it's gonna be time for intake and output. I need to know how much blood came out. Let's say that it was 300 milliliters. And I added the 30 milliliters of sterile saline water. How much was it? The actual outcome of the output of the blood. Send me the text.
330.
So there's 330. And it's called the gum color.
So what?
So how much of it actually is blood?
300.
No? Huh? Gum color, gum color. Anybody? Okay, 300, correct. Because you have to subtract whatever irrigation you're putting in. All right, so now he's doing better. He's gonna need to go home. I'm gonna go ahead and discontinue the nasogastric tube. And this is very good news for Mr. Kirchner because this is not very comfortable. I'm gonna go ahead and first what I'm gonna do is I'm gonna tell him, okay, Mr. Kirchner, you're gonna get to go home. This tube is gonna come out, and you're gonna hold your breath. When I ask you to hold your breath as it's coming out, I'm gonna go ahead and hold your breath and we'll hold it out. So I'm just gonna put in like 40 milliliters, just air, because I want to get rid of all the debris that's in this tube before I pull it out. Just to prevent anything from trickling into the lung as it's coming out. I'm going to go ahead and turn the off to the suction. All right, so now I'm just gonna add the air. It's gonna push all the debris back into the stomach, whatever's left there. I can go ahead and turn it off to the patient, and I'm ready to go. All right. I just take off the tubing here, the tube. Okay. There we go. All right. Okay, Mr. Kirshner, you ready?
Yes, I'm ready.
And you may want to have the blue chuck, because you're gonna have to like wrap it up and then throw it in the biohazard container. Okay, here we go. Okay, sir, you ready? Here we go. Take a nice deep breath in and hold. Just pull it out gently. Good job. All right. And then clean them out. You want to just wrap it in your little blue chuck, and it's going to go into the biohazard container. All right, how was that? Not too bad.
Can I have a Kleenex?
Yes, sir. Yes, sir. And then I want to make sure that there's no pressure areas in the nose. There you go. Need to blow a little bit. Yeah. And then I'll go ahead and provide more oral care. All right, you did very good.
They need frequent oral care because the mouth dries up, especially since they keep it open. Other thing, when she pulled it out, as she's taking it out of the nose, she's not pulling it straight out. You don't want it to rub the nair. Follow the passage of the nose so she's a little bit downward, okay? And that's what she did. Some nurses will pull out and they turn, okay? Or they keep doing this. It's okay, but when they do this, when they're pulling and they're doing this, that tube can turn around and irritate the nair. So they might already have irritation, so that hurts. You don't want to break skin down, so just come out. I only do one of those turns and pull it.
Now we're going to after two. Feeding tube.